Awoi, awoi, kidezata maka.
Kone sangla tuka.
Awoi, awoi, dotran sangla maka. You might guessed it right. Hello and welcome to YJ Connects, where we bring entrepreneurs, social activists to our podcast. I'm your host, Mark Silva, and this is my co-host, Kisley Codras. We together bring to you insightful conversation, inspiring stories about our guests.
Our goal is to bring many more guests on this podcast. Our aim is to inspire you, entertain you, and educate you all. We're so glad that you're joining us on this journey.
Each episode, we dive deep into different topics and themes, featuring and sharing valuable takeaways, actionable tips, and fascinating stories, and lot to learn about our guests. So sit back and relax, and get ready to explore our favorite guest, Dr. Joy.
Hi there.
Welcome.
Thank you for having me here.
You're welcome. And first of all, I would like to say a thank you to you actually, because it is after having that busy schedule of yours, you have still made time for us. Joy or Joy Sana? What should we refer you as?
My full name is Joysana Moraes.
Okay.
But I'm more than happy you could call me Joy.
Joy.
That's how people know me, and I would like people to know me that way.
Okay. I think to make it more easy, we'll say Doctor.
No. Let's keep it very simple, very casual, and very humbling. And I would more than happy if you could call me Joy.
Okay. Right. So, Joy, could you take us back few years back and tell our viewers where you were born and the story about you becoming a doctor. Was that an easy journey for you, or was it difficult?
So I come from Goa, India, and I've been born and brought up in Goa. I've done my schooling at Loyola High School in Margao, and then finished my schooling there. Did my higher secondary at Rosary Higher Secondary School in Navalin. Following the 11th and 12th over there, I went to pursue my medicine in Russia. That was a big challenge, but with deep tap of faith and huge leap, I took the decision to go to Russia. So my journey towards medicine is deeply intertwined with deep, profound faith and selfless aspirations from my parents. Because myself and my brother, we are both miracle babies. After frequent years of praying, we were born, and these were the two cherished miracles which my mom really nurtured to wow, so that she wanted us to be something, pillars for the society. So she wanted one of us to become a doctor, and the other engineer. Doctor because she wanted to do something for the community. She wanted one of us to serve and heal patients, and an engineer, which is a very typical Indian mentality. But I think that's what inculcated in her. So that's what it is. And I think as my childhood, I've always seen medical profession as a very noble profession. People respect it and deeply and look up to the doctors and the healthcare for what they're doing. And every fancy dress competitions, meet up with my cousins. Always had the white coat with the stethoscope toy, and said I want to be a doctor. So also I think for me it was about, even when we went to see our doctors, family practitioners, I would always see them doing something great. So that really inspired me to become a doctor. It's been challenging, obviously. This path is not something easy. You have to work hard. You have to have those commitments to do something great. And yeah, so I finished my med school in Russia, came back to India, did my licensing exam over there, worked for a couple of years there, and I'm here in the UK.
So how long are you practicing
My medicine?
Yeah.
So I would say almost 5 years now.
Yes.
Yeah.
Okay. And so when you move to Russia, I mean, obviously that would be the most
Yeah.
challenging because it's a change
Yeah.
moving from Goa, India to Russia. How was that? Was it easy to adapt the atmosphere and the lot of, because Russia, I'm sure, less English speaking people as well.
Definitely. Yeah. I think when I took that decision, we all young. I was, I think, 17 years of age when my parents and I said we decided that I want to do my medicine in Russia. It was a major decision, not really just for me, but for my parents, because they're investing in money, they're investing in time, they're always also investing in their emotions, because they're sending their one son to Russia to study there, a different country entirely. I think in 2000, when I started, it was 2012. It was people were going to Russia to study medicine over there. It was a major decision, as I said. Challenges were the new culture, new adaptation to the culture over there, and as you said, it's not a English-speaking country. It's a Russian-speaking purely. So adaptation was a major thing over there, and how I integrated over there in their culture.
Okay, but so you studied medicine in Russia, and through medicine, I feel like there's many routes which open up to you. So how did you narrow it down based on your career?
So as I said that, from my med school till I finished, I always saw that I wanted to do something for the service of the humanity. I don't think I have actually thought of quitting medicine then. But to be frank, after coming here, I thought of doing it. But I think primarily because Russia and India is a very conventional countries. They are very focused on, doing something for their country. But I've never thought of diverting from my career. Is that what's the question about?
Yeah, and also it's about how you narrowed down to what you're specialized into.
Oh, okay. Narrowed down to my specialization. Till now, I have not understood what I want to specialize in, but I think it's all a learning process. As you do those things again and again and again, you start understanding a lot of things. For example, when I finished my med school, I wanted to become a surgeon. But when I started off my internship, I realized that surgery is not my cup of tea, because it's long hours in the operation theater. You have to be standing there operating on the patients, so it's a big commitment over there. And I felt like I would not be a good candidate over there for being a surgeon. So if you are not a surgeon, then you do medicine, which is you see like you become like a general practitioner. You work in the ICU, you work in the emergency department. So these are the other specialties if you're not a surgeon. So I think I'm more inclined to medicine, and that's what I want to pursue in my medicine.
Yeah, I mean, just when you're talking about kind of your career path there.
Yeah.
I had a question actually about like how young people, they want to do science or want to learn science, and they want to get into medicine, or they want to get into path to become a doctor, but because of their scores or GCSE scores or A-level scores, they or let's say a degree which is not in a good standard. What are there any other paths that if you're not a doctor, what else can you be in medicine, in science, in that?
I think your question boils down to that. So your question, I think, so is boiling down to that you have a student who wants to do something for the community by saving lives. That's what your question is. Being a doctor is not the only option. Specifically in this country, in the UK, you have other roles that you can take up to work in the healthcare profession. You could become a physiotherapist. You could become a speech and language therapist. You could become a paramedic. You could become a pharmacist. So there are various roles that you could actually, look into if you cannot get into medicine. Because I think when you think about being a doctor, that's your main motto is that you want to do something for the humanity and save lives.
Yeah.
And in this country, you have all these roles, and in the hospital, it's just not the doctor who makes the decisions. It is all other the people I've just mentioned. They are also equally contributing in the decision of the patient's care.
So that basically, like, because I work in a teaching setting, I think for a child, the decision is just not made by the head teacher. It is a joint decision of what interventions that needs to be put in place. Just like, so I did understand. So what you're trying to say, that it's a joint decision, and everybody is involved.
Yeah.
It's just not the doctor.
Yeah, I think as a teacher, you will have to you would know that which student is doing good, which student is more inclined to being a doctor, being a physiotherapist, or who's more inclined into art, fashion, engineer. And then once you know those students, what you could do is you could sit down with them, talk to them, see what is their interest. If they want to do something in medicine, see what is, explore their wishes, see what they want to do in 10 years down the line. And once you know, then maybe you could direct them to the specific of in the medicine career. Could be say for example, you could become a pharmacist, you could become a physiotherapist, you could become a radiographer. So all those things.
So there are
a lot of options in medical career. Yeah.
But as you went into this medicine field, what were some of the misconceptions you faced as being a doctor?
In terms of misconceptions,
because there's one like saying that, okay, when we need the doctors, it takes a long time for them to actually, especially here in the UK, to get an appointment is very hard. So it's like some people directly pinpoint out to doctors, they don't want to see us. Or something.
Yeah. I think it sadly, working in India, studying in Russia, and now here in this country in UK, I think what I've seen is that I think it boils down to the system, okay, and how good or bad it is managed, ultimately. And when I say that, it's if you have a proper system in place, it could be seen by a doctor immediately. For example, say in Goa or in India, if you go to any state in India, you go to a doctor's office, you get seen immediately. It's because you have the money. It's a private system over there. Most healthcare clinics work in the private settings. So you go there, you walk in the clinic, you get your tests, you get your diagnosis, and then you have a treatment option plan. Whereas in the NHS, it's a government hospital. However, it's a free system. It's a public system. It's one of the benefits of having a public system because it's free, so you don't have to pay out from your pocket. But it comes with its own perks and it comes with its own disadvantages. Now, I think it's changing slowly, but it's going to take time. Yeah. So the misconception is that it is not doctors who don't want to see you. It's just that they're overburdened with the system.
And just about that, I've experienced that myself as well. That and many people that I've kind of spoken to have said this. The consultant or the GPs, when you go to them, they don't know what you're talking to them. And they Google it, and they're Googling it, and they're going to tell you the same answer that I have Googled at home. You know what I mean? Like, what is that? What is that?
So, do you mean that you actually have seen a doctor when you go to a GP they type out and you see a Google tab open on the computer?
Yeah. And it's like, just find a word for you. They Google, then they'll start Googling it. It's like, okay, so on the Google it says you have to take 2 steps. I've seen that, and it has happened.
Okay, I don't know which doctor you went to.
I need to start thinking about which doctor I could know. I don't want to name the hospital, but yes, I have. I have come across actually 2 times this thing.
Okay, sadly, I'm sorry about that. How you felt? But what normally happens in the GP practice, I would say, is that that the doctors will type something on the computer, but they're looking on a guidelines.
Okay.
They will look into the guidelines. Sometimes they may have their phones open or their computers open, and they look into the guidelines. Now, in this country, in the UK, all medical professionals have to treat you on evidence base.
Okay.
So if you, and there's one body called as the NICE, okay? So that body determines all the evidence of your medicines, of your diagnosis, treatments, and everything. And based on those specific guidelines, the clinician offers you treatment, medications, and everything. And sometimes the clinicians don't have it on your back of their mind, and so that things don't miss out or not given to you, is not given in the wrong way, they would normally look it on the system. So probably that clinician must be looking on that NICE guidelines and offering the treatment.
I mean, yeah, most probably that would be the right thing. I mean, but a lot of Goans do speak about this thing where they use Google. I mean, so now hopefully they understand why they're using the why they're using their laptops or the computers that are there. Obviously, as you said, it is for the evidence based. Yep. Go.
Because ultimately, what we are taught in our med school and when we take the Hippocratic oath is that do no harm for our patients. And so, and ultimately, if you prescribe a wrong medication, it hurts you, and ultimately it hurts the clinician who's prescribed the medication. So to avoid that, and to be assured, and to be sure for the clinician who's prescribing the right medication or looking into the investigation, they would obviously look on the guidelines and then give it.
Joy, I had a question. You seem to be quite fit.
Yeah.
Right?
I choose to be fit.
You choose to be fit. But is this just because you want to stay healthy, or is you...
Today morning when I was getting ready, when I was getting prepared for this podcast and I was getting ready to come for this, my mom is like, "Tu barik zala," and I was like, "No, mama, I'm not become thin. I want to be that way."
Yeah.
So we have this. I think in the Indian culture we have that if you are like 90 kgs or if you're 80 kgs, and you look healthy, plumpy, it's the way of how people have classified it as, oh, you look good. But if you see a skinny man, or if you see well fit, oh, he to kai hai na.
But you can still be fit if you're still skinny, no?
Yeah, you can still be fit if and you can be skinny as well. So ultimately, I choose to avoid certain food, certain diets. I choose to go to gym because I want to stay healthy, and I know what is the good sides of being healthy.
Saying that about just because you brought dieting up here now, I'm just gonna ask you about. There are some girls. Should I say girls? No, I'll just say everybody. Most of them I know. They do something called intermediate fasting.
Oh, yeah.
Is that what?
Yeah,
that is what it is called, right? Yeah. So they won't eat the whole day. They'll eat only one meal a day. Oh, what do you think about this? I mean, is this healthy? Like, is it going to keep them fit, or what do you think? What are your views about that?
I think our conversation is getting a little juicy over here.
Yeah, it should.
Yeah, so this is a very good trend, which is on the internet, and everyone is following it in the fitness and in the health industry, and I do follow it as well. Intermittent fasting. So you see, intermittent fasting is something where you cut down on one specific meal. It could be anything. It could be breakfast. It could be lunch. It could be dinner. And when you do that, you're reducing your calorie intake of the day. Now, for example, you go to sleep. You have your meal at 10 o'clock. You wake up in the morning at 7, and then you have your breakfast. That's actually like a fasting you do over the night. But in intermittent fasting, what you do is you just prolong your fast a little more. Say, for example, you eat at 10, and then, you have your meal next day at, say, 1 o'clock. So it's a 16 hours fast. Or take your last meal at 8 p.m. So what it does, it reduces the calories in your body, and ultimately it burns fat. It burns fat. It's good for your insulin in your body, And what happens is when you eat lot of meals, for example, say if you drink Coke, chocolates, these are sugar products, yeah. And what sugar products does, it spikes your insulin level in the body, and one of the major reasons for having diabetes is because you have a hormone in your body, insulin, which stops working, and that's how you get diabetes. So research says that intermittent fasting also helps in reduce and in curing diabetes.
But speaking of fast diet, so people choose to eat specific things to maybe keep them healthy.
Yeah.
But do you think that's the only factor they should look into? Because sleep is a good, important factor as well. So is it just one thing, which is the food itself, or is it overall everything?
I think you're rightly correct what you're saying, and I definitely agree with you that it's just not one factor which plays an important role in having a good lifestyle or a good healthy diet. It is amalgamation of a lot of the factors. Good sleep, good fitness activity like running, sports, good emotional balance, no stress.
Yeah.
That I think that plays an important role in having a good healthy body.
Joy, this might sound so silly of me saying this. It says a kiss can burn 2 to 3 calories. What do you think about that? In a minute, I give you this. And if you're passionately kissing, it can burn few more calories.
I really don't know where you're getting all these questions, but I would really focus on running on a treadmill and burning calories rather than kissing someone so passionately.
So all those who are talking about kissing here, not good. Start running.
I think obviously, if you run on a treadmill or if you go for a run, you'll burn more calories and I think your focus should be on burning more calories rather than burning on less calories.
Yeah.
So kissing should not be an option, to burn calories.
Or else everybody would have been kissing.
Exactly.
Isn't it?
Something I had in mind was, I don't know if it happens here, but in Goa, when the doctor used to give you a prescription, they just used to write randomly Buroitale, and then used to take it to the pharmacy and they were able to read it.
Yeah. So here in the UK, definitely not happening because you have electronic prescription. So you get a green form, you go to the pharmacist, and then they give you the prescription. Back in India, we have this where you just scribble. Maybe it's because you don't, clinician don't want to see doesn't want you to know what is written there. But I think it's really not good for the patient because ultimately the patient is the one who's going to take this medication.
Right. So basically, I had something in mind, and I've read it somewhere that UK is the second most miserable country in terms of mental health. When you talk about mental health and those kind of things, what do you think about it?
I think UK, I don't want to be more very categorical, but to classify as UK the second most country in terms of mental health. But what's really happening now is that mental health is a major issue across all the health systems. And what was a tipping point is when COVID pandemic hit. That's when people started talking about, about their health, about what they have undergoing through, because that was a moment of isolation where you would not connect with people, you would stay indoors, you would do things online dating, online, lot of things, and that's where it got more exacerbated. And this is happening across all the Western countries, I would say so, because the prime focus is about gaining the power. I want to do something, so it's ultimately self-centeredness. And when you start off-balancing a lot of other things, you start having those stresses, and specifically the mental stress. You start feeling anxious, you start feeling depressed because you're not able to do those things. For example, we were just talking about weight issue, where now online you have this self-promotion, people talk about good diet, good lifestyle, a lot of money. So people start comparing themselves to what's happening on the internet and to their normal lifestyle. And they see there's so much of disconnect. And then that's people start thinking about all these things, stresses.
Yeah, because I've seen a hike in terms of mental health in schools as well, because I'm currently part of my job is also kind of looking at the social emotional mental health side of things, and we are very big on SMH. So, and then there has been rise. I mean, young people now find it kind of easier to express themselves in terms of if I'm feeling down, I will kind of go and tell to my teachers or to whoever. But also looking at that, I think when we are emotionally down, we find it difficult to speak to our parents, and we go to and speak to third person. Um, which is good. At least you're speaking. But the third person then tries to take you. If it's a professional, obviously the
confidential.
the guidance will be given or whatever. But if it's a wrong third person, then you could lead to a different direction.
That's right.
What are your views on that? Like, who do you think that if I have mental health, or experiencing mental health, who do you think? Where do you think we should go?
So, in terms of, you always need to seek out for help when you know that you have some issues that you have to deal with. Having said that, some people don't express it very evidently, and it gets bottled up, which could be a tremendous effect on yourself and the people around you. If you are experiencing, for example, if you see someone, a child who's undergoing a lot of stress, then I think it's the responsibility of you to guide that person to a dedicated healthcare professional who will eventually help them into getting the right amount of treatment and help. So I think that ultimately boils down to that.
I think within like our Goan community as well, or back in Goa as well, we never used to use the terms like depression or anxiety. We never came across those words, and I feel like we never really went into speaking to someone, like saying, okay, using those words like depression and anxiety, openly speaking about it as well. And when you suddenly come here and youngsters, especially when they use the terms depression and anxiety, I think it's harder for parents to understand themselves as well, I feel like, isn't it?
Yeah, because what happens is that, in India, it's a taboo. It's a taboo to speak about your mental health because you looked upon as something down. It's a weakness, people look into it. Whereas in the UK, it's very open to speak about it. And it's good to reach out to people when you're having those issues. Having said that, I don't want to compare Indian culture to the UK culture. Because they have their own. Indian culture has its own aspects. The UK culture has its own aspects. But to look at from the UK lens, it's good if I wouldn't say it's good to have depression, but if you have depression, if you have anxiety, look out to people, reach out to people, and people are always there to help. But look and reach out to people who are professionals in those areas.
Right.
Who will help you and not take you, in the right way. Now, for example, Instagram is a total social media where you have, you have random people giving you random advice. It may not belong to their remit. They may not have degrees on those areas. They may be using their own personal experience. And when you put it out across on the social media, what a lot of the influencers do is that a lot of these content influencers, what they do is when they post it out, they put it out in bits and pieces. So you tend to lose the whole context in what they have said. And when a vulnerable adult or vulnerable child looks into that onto that content, they take hold on that, and they start building on their ideologies. They start believing those things, which could take you in the wrong way.
I know, or clients, you could say, have kind of taken that on board, and they're kind of saying that it is happening to them. And that they've gone to that zone where whatever they see, they feel like that it's them and them experiencing it, and then which does not result obviously in good in a good format, whatever.
So I would really advise is to the youngsters would be to listen to your people who reach out to you in a good way, and be open to them, even if you don't agree to your advisors, to people who reach out to you. Listen to them, take it on it, hold on that, and then reflect on it. And ultimately, they're doing it for your own benefit.
Right.
Yeah.
Joy, before we go on to a game segment,
Yeah.
I just want to ask you a last question before we go on.
I have a thing as well.
You have to say something.
Yeah.
Let me ask and you can ask.
Okay.
So,
It's a
um,
different topic. So.
okay. In terms of backbone, who has been your backbone throughout this journey? Like, it's to be a doctor is not easy. We know that. I mean, through movies and all those kind
Yeah.
of things. But the study is very difficult, and you got to learn. You got to
Yeah.
be very focused. Who has been that backbone for you to support you throughout this journey?
I think my parents, to be very precise, and because they have sacrificed a lot in terms of time, dedication, their careers. They have been very passionate for us, to do something great for the community, for the world, and specifically is my mom, because as I said in the start, we were the miracle babies, and she always wanted some of us to do something, both of myself and my brother to do something, and she's the one to be more.
So, can you hold on to your questions, or should we play a game?
I'll ask in this one.
Yeah.
I'll ask in this one.
Go ask.
Are you asking me formally or? Okay, I thought you were like general.
No.
Now I'll ask in this question. Atau tu kayak sang best sang cut ringa. I'll ask it as a myth.
Yeah, okay.
That's what I meant.
Okay.
Yeah.
No, you can put this part also.
Yeah, you see.
Yeah, that's people. Because we were not ready.
Yeah, I was.
Just like people, we are not scripted.
Yeah, not scripted.
Right. Okay. So, Joy, we're gonna play a game now. It's called the myth game.
Yeah.
So we're gonna bombard you with different myths.
Okay, let's get into see again.
I think mostly Goans have that in mind.
Yeah.
No, I think it should.
Maybe
not
other
label it
communities,
Goan. I
yeah.
think everybody has that. So, what do you think about it, kind of thing?
Yeah.
Yeah. Okay.
First one, an apple a day keeps the doctor away.
Yeah.
Yeah. You can have this apple.
Thank you.
Yeah.
So, can you hold on to your questions, or should we play a game?
I'll ask you in this one.
Yeah.
I'll ask you in this one.
You last.
Are you asking me formally or? I thought you were like general.
No.
Now I'll ask him this question. Atau tu kayak sang best sang cut I'll ask it as a myth.
Yeah. Okay.
That's what I meant.
Okay.
Yeah.
No, you can put this part also. Because to see, that's people. Because we were not ready.
Yeah, I was.
Just like people, we're not scripted.
Yeah, not scripted.
Okay. Right. Okay. So, Joy, we're gonna play a game now. It's called the myth game.
Yeah.
So we're gonna bombard you with different myths.
Okay. Let's get into see again.
I think mostly Goans have that in mind.
Yeah.
No, I think you should not label it Goan. I think everybody has that. So, what do you think about it, kind of thing? Yeah. Okay.
First one, an apple a day keeps the doctor away.
Yeah.
Yeah. You can have this apple.
Thank you. So I think I have never actually, Googled it to know where has this phrase come up and everything. But if I think logically, apple a day is like an apple is a fruit, and it has a lot of vitamins and minerals. And I think it pre-originated from, if you eat this apple, you'll be good.
Healthy.
I'm not sure. But I don't want to be, very scientific and thing. But this is what I understand.
The other thing is that if you stay outside in the cold, you will catch cold.
If you stay outside in the cold, you catch cold. Nice way. But I've lived in Russia, never got cold. No, but
It's just myths.
I think, obviously, if you're going to stay out in the cold for a long time, you're going to catch cold. How much? How many times? I don't know. But yeah, you may or may not. Yeah, it depends upon your immune system.
Right.
How good is your immune system?
Next one is eating carrots can improve your eyesight.
Yeah, I think that's a evidence. I think. Yeah,
Okay.
it does. It does.
Okay, that's nice.
Stress can turn your hair to in gray.
It does. It
Stress.
does. It's, yeah, stress.
It does?
Yeah, it does. My hair's
Yes.
are turning grey.
Oh, my hair
That is
turning
mine.
grey.
I think mine
no.
also from the back. I think they are. Yeah.
Oh, goodness. Hair grows faster after you have a shave.
Yeah, it does.
Okay.
Cancer is always a death sentence.
Yeah, it does.
Okay. Why do you say that?
Because cancer is a disease which could be cured, which can't be cured. Even if it's cured, it comes with its own perks. It comes with its own dangers. You have to undergo treatment, which is chemotherapy, which is not very kind to your body, and that could have an impact on just not on yourself, but on the family. And it on the family, it could have on the mental health, it could have on the finances. So it's like a death sentence. Ultimately.
Next one is, does the solar eclipse affect pregnancy?
You know, we as a med school and in my medicine and even in my higher secondary, we discussed this. There is no evidence behind this thing, but if you look into that, a mother would not want their child, like the baby in the womb, to be affected. It's a natural instinct. So a mother will do everything possible not to hurt the baby growing. And if it has to stay in bed, that's a myth, I think. You have to stay in bed all the day. People do it. It's a very culture-driven myth, but in the UK, no one practices it.
I don't know, this might actually, this is not a myth or whatever, I don't know. But this is a silly question actually. Birthmarks. How do we get birthmarks? It is a silly, I did say it was a silly
No,
question.
it's not a silly question. It's what's the word? I can't remember.
And this is out of curiosity also I'm asking in this.
No, it's not a. What's coming back to your question.
Birthmarks. You know what?
Yeah,
birthmark,
yeah.
How do we get that? Or is it like a, because again he said about the solar eclipse.
Yeah.
There are times where I have seen where a child's face would go red on one side or whatever, or I had a friend whose this part was just red. So and when I asked why, they said it was solar eclipse. So that's why I asked, is it the birthmarks also something related to that, or?
No, I have never come across in my career about the way solar eclipse has caused so and so problem. But people are genetically born with birthmarks.
Okay.
It could be as small as a granule, like a mustard seed on your body, or it could be a big patch on your face, as you said. But it's nothing to do with a curse or something which predates that. It's a genetic thing.
Yeah.
Okay. Also, drinking milk after eating eggs can cause loose motions.
I don't know, to be frank.
Actually, for this one, because it happened to me a lot of times.
Really?
Yeah.
So do you? Otherwise, if you don't drink milk with egg, do you get loose motions?
If I don't drink milk after eating eggs,
yeah.
I don't get loose motion.
So okay. So even if plain.
What do you mean you don't get loose motions?
Like if I eat eggs and then drink milk, I'll get loose motion.
Only loose motions is when he drinks milk.
Yeah, that's what happens though.
So you get loose motions after you drink milk.
With eggs, like if I eat egg, if in the morning, if I have breakfast, I eat egg, and if I drink milk,
Guys, all those are watching, don't. During this time, okay? Just wait, hold on.
Yeah,
This
so-
conversation is okay. Go on, carry on.
yeah, that's what I wanted to know if it happens, if there's a logical reasoning, is there some kind of reaction?
There should be some kind of reaction, but I wouldn't know exactly by sitting here.
Okay.
What are the logical and evidence behind that? Yeah.
Creative team wanted to know. Put everything on the creative team wanted to know.
I need to know.
Having paneer and fish together.
That's not a good
it is.
combo
That
to
is not
go
a
for.
good combo.
That's not a good
I mean,
combo.
not as a doctor, but no one will eat that.
Yeah, I think eggs and milk is something we can have in the morning.
Okay, someone please Google it.
Yeah, please do.
Can we Google it and find out?
Actually, I don't have my
I don't
phone.
have my phone either.
Do you have a phone?
No, I
Guys,
don't.
please Google it
Everybody
for me.
has phone.
And then when it's live, just type on the comment.
Just type it on Google and see. Okay, we can see on the prompter there.
Yep.
Does having sex hurt?
Who is typing all these things?
Hey, that's Youth Goan Association website as
Who
well.
is having all these
Huh? But it's the Youth Goan Association account.
Whose phone?
Who is using this channel?
Who?
account?
No, it's the official account of Youth
Yeah.
Okay, fine. So that means someone has
No, but
used.
still someone has
So
searched.
someone has
Yeah.
searched it.
Someone has searched.
So it's not search, it's Google bring it
Oh,
up,
okay.
Oh, okay.
Okay.
Because probably searched more often.
Oh yeah. I agree on that. Yeah.
It's a search engine.
So, but actually, does it hurt?
Yeah, it does hurt.
Sex.
Okay.
My God, PG.
Why didn't you go?
So there is no scientific evidence that eating fish and paneer together is harmful to one's health.
Can you search egg and
Yeah, can you search
milk?
egg?
Because I never searched it actually.
Copy paste open now.
Oh my God.
After 1 hour later.
Ah,
1 hour later.
So your photo is there.
So
is it?
no, can you go back?
Yeah, go back.
And there's a drop down. There's a drop down here. Do I have diarrhea? Egg intolerant. Okay. So you may be intolerant to egg,
Okay.
but have you eaten eggs, just plain eggs?
Yeah.
No, remember when we went
Yeah,
to McDonald's?
and that was the thing as well, hot chocolate.
Yeah,
which-
I think he had hot
I-
chocolate and egg.
and that's
together.
not the first time it's
Okay.
happened. But that was the worst one
Maybe
that's
that
happened
combination does not work for you.
for me. Yeah. So I just wanted to know
Yeah.
if it's others as well.
No, I don't think. I don't think it may cause for someone, but there is no proper. What do you say? It may be or may not be a proper diagnosis of. But yeah, because some people are lactose intolerant, fructose intolerance.
Yeah.
Yeah, so.
Yeah.
And it is a you problem.
And some other viewers probably.
Yes. Okay, so I think that was a good round actually.
Yeah.
Nice.
I enjoyed it. Let's move on to something, a bit more deeper questions.
Yeah.
Really, when, for example, a person is going to an operation, and you see this in movies quite a lot.
Yeah.
They'll come out of the operation and say, "Sorry to say, but we could not do anything," or they will say,
Yeah.
"Everything is in God's hand." Those kind of things. But how do you look if you had to go and tell a family that it's not looking good? Have you come across this, and how did you what's your way of talking to the patient?
This happens every day in my day-to-day life because I work in ICU, which is a critical care unit, and you have very life-threatening conditions which patients have, and sometimes they don't survive those admissions. Sometimes they are so critical that we don't know what's going to happen in the seconds. So you have to break that news to the family, and it can be challenging from the clinician's point of view because the family is not expecting that news. They think that if the patient comes to the hospital, they get admitted in the ICU, they'll be fine, everything. But no, it doesn't happen that way. Sometimes they don't survive. This is the most challenging. How do I do that? So as medical professionals, we always taught how to break the bad news to the family, next of kin. You have protocol called, to be more specific, you call it spike protocol. Okay, I wouldn't go too deep into that, but it's a way of understanding the family, trying to understand what they know about the patient, how much do they know about the condition, then to tell them how much we have done. Okay, and ultimately saying that is not possible, but that comes with practice. It comes with a lot of emotions because you have to put yourself in the patient's or in the family's situation and understand that.
This might be a strong word to use, but being as a doctor and working with patients and experiencing that kind of scenarios, is it a traumatizing experience for you, or at the start initially?
Yes, it was traumatizing because in med school, in medicine, and in our studies, we're never taught this situations where you have to go and break. I mean, in real life, you have these role plays that you have to play, but those are like just the gist of it. When you go and actually break those news, initially it could be traumatizing, but over the years, if you do it again and again, you learn how to speak and how to break that news.
Yeah, during the COVID time, how was it during the COVID? Because obviously there was
man.
lot of things going on, and
Yeah.
how difficult was it for you? Because we know how difficult it is for NHS during that time.
And I've heard stories in the NHS. I was not here in the NHS during the COVID time, but back home it's been traumatizing because you were not allowed to see your mom or dad or brother, sister, whoever was admitted in the hospital with COVID, and you have to break that news over the phone. But you have to break the news at the same time showing respect for the family and telling them that we have done everything to the patient. Sometimes there's a mistrust. Their patient's family will be thinking, oh, we have not done everything. But COVID was such a disease that no one knew what was happening. No one had the proper guidelines, proper set of treatment. Everyone was doing what was out there in the media. If there was if there was India doing one specific treatment, UK was doing one specific treatment, they were just trialing it out and doing it as long as it saves the patient's life.
But what does your day-to-day life look like as a doctor?
So you want me to be specific? From
the start of the day.
So my day,
Yeah.
my day in the life starts actually the previous night. Say waking.
No, why am I asking this? Because so that your friends who are watching you, they should know that not to disturb you. I'm helping you here.
So yeah, I come home at 9:30, 9 o'clock, get ready, freshen up, eat dinner, everything, and then I put my phone on alarm, and I put 10 alarms. I put at 5:30, 6, 6:30, 7, 7:30. This is what it is. Because if I sleep like a zombie.
Right.
Yeah, like a maniac. I won't wake up. But yeah, sometimes I don't wake up at all. I wake up at like 7:30 and I run for my life. But yeah, at times I wake up in the morning at 7:30, get ready for work, go, and I live very nearby to my hospital, so it's a good thing for me. So it takes like 20 minutes commute from my work. Reach for work, start getting the handover from the night team. And then we discuss the patients in the morning, what plans to be done and everything. And once we discuss the plans, then we go assess those patients. We assess those patients, then we speak to the family, and then before that we have lunch, speak to the family, then do again another round, see how the patients are doing, till 8:30. And then at 8:30 I finish and I come back home.
Have there been instances where there's an emergency and you have to like just rush to the hospital?
No. So in the NHS in the UK, you have this one system that once you finish your work at 8:30, or say at 5, you have appropriate workforce which have been assigned to cover that hospital out of hours. So you don't bring your work home, and which is a good thing. In the UK, you have an appropriate work-life balance. That's one of the good things in the UK NHS system.
Because there has been news that NHS needs more staff and there is a need of more doctors. That's why they're taking more international people to work in UK.
Yeah.
So how is it going though?
So there are still thousands of vacancies out there in the NHS, still relying on the workforce, and that is one of the major challenge for the NHS, which is currently facing. And which is one of the issues that has been really discussed right now in the political manifestos and things like that. How to save the NHS, because NHS is having its own issues, and how to deal with those issues. And major issues are staffing crisis and burnout.
Yeah,
That's true.
that's the biggest.
Yeah.
Because during the COVID also there was a lot of
Yeah.
those.
That was the eye opener for everyone.
Yeah.
COVID was the eye opener of severe burnouts in the medical healthcare professionals because of long hours of work, no pay for the clinicians or for the healthcare professionals.
But do you all get, because do you all get some kind of counseling or do you all get some kind of support to help you all with that,
in terms of
to burnouts or
yeah.
just kind of to regain or reflect really?
Yeah, so in my critical care, which is a very intensive specialty, because you see a lot of deaths, you see a lot of critically unstable patients. We have a psychologist in our department. I don't know how it happens in the other hospitals, but in our department we have a psychologist. So if you have a problem that you have been bottling up for quite some time, you can speak to the psychologist, and that psychologist is very, very good. She's available all the time, even on out of hours. So they're very keen on having the mental support for our clinicians.
Yeah, I think it's time for another game.
Yeah, sure.
Yeah,
Sure.
let's have another game. It's called the rapid fire.
Okay.
It's a common game,
Cool.
which
Yeah.
I think everybody plays really. So we'll ask you a lot of questions, and then you just have to kind of choose or give one word answer. If you want to kind of explain,
Fine.
you could. I would suggest not to.
Not to use that.
Oh my days.
Just get it on the.
Okay.
I think can we take a break? Actually? My throat. So I think it's time for another game. But before we go on anywhere further, I just wanted to ask you another question, silly question. You said you are obviously you're a doctor. You said your brother is an engineer.
Yeah.
Your cousin is our sponsor, Cut Masters, who is into graphics and everything. Your cousin, who is going to be midwife in making, I would say. And so, what you all are thinking, just to have the whole, NHS at home, or?
I think we want to be self-sufficient and self-reliant. That is what we are. But no, but to be very serious on this, notice that everybody wants to do something in career, and I think that's a good thing.
Yeah.
It boils down to what do you like, and if you like something, things will just come to you. So yeah, everybody, I think, Kut's master, he's very into this.
And then also, if mom or dad are not well, would you go and you would?
Yeah,
it's easier for them. They don't have to go to NHS. You can just do it at home. Or you suggest them to go to NHS.
No, so there's a catch there. So I would obviously, assess them. I would check their blood pressure, listen to their chest or heart. But I'm not allowed to give them the treatment because that is so we have some etiquettes and some ethics of our profession. So I'm not allowed to prescribe, to advise for treatment for my close ones, even to friends and family.
Okay.
So yeah. So if you have to call me and say, Baba Kizal Maka, this and that, I will tell you. But am I able to prescribe you medications? No.
No.
It's a GP who has to prescribe you the medications.
Right.
It has to go through his channel.
Okay.
If I have own private practice of mine, you come to me, I could prescribe that for you.
And is there any plans for that?
Not at the moment.
Not at the moment.
Yeah, because I haven't seen myself doing private practice.
Okay.
Something for the public welfare, and more where people don't have to pay out from their pocket. So I haven't thought about that yet.
A few questions. You just have to choose either one of them
Yeah.
or one word answer. Okay.
So, first one, coffee or tea?
Coffee, definitely.
Coffee.
Early bird or night owl?
Early bird.
Early bird. Okay. Best part of your job?
To have a positive impact on patient's life and family.
That's nice.
Stethoscope or thermometer?
Stethoscope, definitely.
One place you love to travel?
Goa.
Wow. Okay.
Best part of your job?
Best part of my job is saving lives.
What's your favorite healthy meal?
Health?
Healthy meal.
Healthy meal. I would say definitely chicken and salad.
Okay.
that's
And
nice.
favorite cheat meal?
Cheat meal would be chips, burgers.
Okay. One piece of advice you would like to give our audience, just out of your head.
So I think this is Goa Youth Association, right?
Youth Goan Association.
Youth Goan Association.
Youth Goan Association. Yeah, I was just I was looking at the promo where Louis Bachchan was
Yeah,
like,
he
"Man, I
was-
won't karo zai."
Yeah.
So I was like, okay,
Yeah.
I just got I got lost in that. So it says Youth Goan Association. Yeah, you guys need to change something about this. Yeah, make it more very catchy.
Catchy. I think
Yeah.
we should.
We were discussing about it.
Yeah, I think that is the plan that we have spoken to again Cut Masters, and we are going to release a new logo.
Okay.
Not so soon, but that is in the making.
Yeah.
Until then, I think the people and the guys who come and sit here, I think they need to learn this. Go Youth Goan Association.
Yeah.
How to pronounce it in the one straight way,
Yeah.
brother. So, and I think you guys are targeting a lot of the Goan youth.
Yes.
Yes. So, my advice would be is now some of you have come from Goa to UK. So there's been a transition. And in that transition, a lot of you will be in a situation where you will start questioning yourself, why am I here? You will start navigating into the education system, even find difficulties in finding jobs. So, and it could be a culture shock to many of you. Okay, so I think you have to start thinking about it, and which is a normal thing. And once you start thinking, then speak to people, find out what you could do, what you can't do, and ultimately you will be able to do the right things for your career.
Until then, I think for the people and the guys who come and sit here, I think they need to learn this. Go Youth Goan Association.
Yeah.
How to pronounce it in the one straight way,
Yeah.
rather. So, and I think you guys are targeting a lot of the Goan youth.
Yes.
Yes. So, my advice would be is now some of you have come from Goa to UK. So there's been a transition. And in that transition, a lot of you will be in a situation where you will start questioning yourself, why am I here? You will start navigating into the education system, even find difficulties in finding jobs. So, and it could be a culture shock to many of you. Okay, so I think you have to start thinking about it, and which is a normal thing. And once you start thinking, then speak to people, find out what you could do, what you can't do, and ultimately you will be able to do the right things for your career.
Okay.
Yeah.
Moving on to the questions.
Mhm.
Thank you for sharing that. Moving on to the questions. What do you do in your free time?
I read books, go to the gym, and recently I've got into plants. So yeah,
Gardening.
gardening,
Gardening.
yeah.
That's nice.
house plants.
What's the best piece of advice you've ever received?
That I'm very people friendly, and I'm very charming.
Okay.
Single or taken?
Taken at the moment. I don't want to.
No more questions.
No.
No more
Let's
questions.
keep it personal.
One place you would love to travel?
One place I would love to.
Should
I
I- you
asked it, I
that?
asked it, I
Sorry,
asked it.
It just came in my mind as
Oh,
well.
okay, that's
Yeah.
fine.
Anyways,
Goa.
okay, we're not scripted. That's why.
Yeah,
it
no,
comes.
it's good that you said that. Yeah.
Okay, so that was the rapid fire round. We will kind of extend another game now.
Okay.
We'll play another game. It's called the medical trivia.
Okay.
So again, we will ask you questions. Now we are checking your
Whether I'm a right
yeah,
doctor, the false doctor.
all
Yeah?
your degrees.
We'll have
Yeah.
the questions on the screen, so then you can comment as well, guys. Please comment.
Who you're telling?
The audience.
He's telling you guys that. Go and see.
Yeah, so we will have the questions on screen. So if you know the answers, just write it on the chat. Thank you.
Yeah. So, okay, the first question is which vitamin is known as the sunshine vitamin?
The vitamin D.
Okay. What is the average normal body temperature in degrees Celsius?
I would say roughly around 36 to 37 degrees Celsius.
Yeah.
Right. What is the function of red blood cell?
To be, I would say medically, to generate and to maintain the homeostasis in the body, or to produce a good cells in the body. Yeah.
What organ is responsible for producing insulin?
Pancreas.
Chris?
What is the strongest muscle in the human body based on its size?
I think it's the jawline muscle,
Yeah.
which
Yeah,
is the
okay.
masseter.
How many bones are there in an adult human body?
I think it's 206.
It is.
Yep.
Why do you laugh? Why do
I
you?
laugh because I asked the same question to someone else. And the person answered 360. And the person is myself. So I was laughing because I was like,
You get a newborn every day.
yeah, 365.
Yeah.
Silly me.
Which part of the human body has the largest surface area of skin?
Largest surface area of the body.
In terms of skin.
In terms of skin, I think it'll be the front side of the body, torso.
Torso, yeah.
Okay. What is the smallest bone in the human body?
The stapes, which is in the ear.
Okay. How many chambers does a human heart have?
4.
What year was the first successful human heart transplant performed? So,
1967. 1967.
1976.
Wow.
Oh, you flipped the numbers.
Okay.
Okay. That's good. Close.
Close.
Which vaccine was the first to be developed in history?
Was it smallpox?
Oh wait, I think it's sorry. Which antibiotic was the first one to be developed in history?
Penicillin.
Penicillin.
Who discovered penicillin?
Alexander Fleming. Why are you guys laughing?
No, because we're just messing around today. I think we have quite got
Very
comfortable with
casual,
you.
yeah.
Because whenever we go to a doctor's what do you call that office
Clinic.
clinic,
Yeah.
we would be like, doctor, kizalte began sangu. And here we are like, yeah, damn now.
Yeah.
That is
That's-
nice because I think the nature is only like
Yeah,
that,
yeah.
quite made us comfortable. really.
Thank you.
So before we end, we would like you have given a lot of advice throughout this podcast today, but a last message to our viewers, especially the young people that are around and their families, because most of the families obviously they want the kids to go into science line or whatever. What message would you give them?
I think my message to the young youth and to the children would be, listen to your parents, because I think they're your greatest advisors and educators. You may disapprove their beliefs, you may disapprove their advice, and I think you need to understand from where they're coming, because their beliefs, are shaped by the cultural upbringing, by their background, their life experiences, and whenever they say something, you always have to take into context why are they saying those things. And once you know that, you could obviously sit down with them, talk to them, but talk to them very nice and compassionate manner, and tell them, Mommy, Daddy, see, this is what I want to do, this is what you want me to do, but ultimately I want to do this, so and so, so and so. So until and unless you have this conversation, you won't be able to have that agreement with them, and obviously there could be a lot of fights and things like that. So respect their decision, and ultimately they will respect your decision. So you need to have this conversation. Yeah.
Yeah,
With them.
So yeah, thank you so much for kind of sharing that and giving the piece of advice. So again, I would like to take this moment to thank you and thank you for your service in public sector actually, because we wanted a Goan doctor to come forward, and because I think there are less Goan doctors in UK. So we wanted doctors like you to be in the making as well, so that our kids, our young people who are watching us, or viewers who are watching us, get inspired by you and about the work that you do, and they can kind of follow your journey.
Thank you.
So before we end,
Can I add on to that? If anybody wants to reach out to me, want to get an advice, I'm more than happy to help. You could reach out to me on my Instagram, and I think they would put it up on the link with my Instagram handle, and I'll be more than happy to help. But that'll be free of charge. Don't worry.
Before we go now, we have got something very small for you,
No problem.
because you are looking at your fitness, and it says that the Apple apple a day keeps a doctor away. We've got a whole set of fruits for you. So this is from Youth Goan Association.
Oh, thank you so much.
On the whole things we have. Before we end today's episode, I would like to take a moment to thank our amazing sponsors, Z Travels and Arya Cafe, our media partners, GNC Studios, Cut Masters, Awaz Radio 99.8 FM Southampton.
And not forgetting our advisory partners, Goan Welfare Society UK, GOA UK, and Young Giving Foundations. Thank you, and stay connected with YJ Connects.